Good evening. My name is Yolanda Gassman. My proposition is excessive alcohol and drug abuse are major contributing factors for schizophrenia. What is schizophrenia? The term was coined by Professor Eugene Bleuler, a Swiss psychiatrist who is best known today for his studies on schizophrenics. Schizophrenia comes from the German origin schiz, meaning splits, and phreni, meaning mind, split mind. In other words, split personality. It is a brain disorder that affects how a person thinks and sees the world around them. Schizophrenic has multiple personalities. But why do they have this condition? There are several causes identified and they include genetics, trauma, stress, excessive drinking alcohol, and taking illicit drugs. However, alcohol and drug abuse largely contribute to the development of schizophrenia. The Centers of Disease Control and Prevention also list use of alcohol or illicit drugs as contributing risk factor for mental illness. As one who has worked in the healthcare industry for many years, I have dealt with many patients with mental health issues. There have been few instances in which a history of a severely traumatic event took place and triggered a psychotic break in a patient who already has a genetic predisposition for schizophrenia. But the number of patients who experienced this were very minimal compared to the numbers of those patients who had history of drugs abuse and alcohol abuse or both. Prior to hospitalization, most of them were living a normal life. Some became involved with wrong crowd or friends and did foolish things like drinking alcohol excessively or taking illicit drugs. Some had tragic events in their life that resulted in their decision to remedy their problems with drinking too much alcohol and using illicit drugs. Some of them were able to recover through medication treatment, psychotherapy, support groups, and 100% abstinence from drugs and alcohol. Now let me convince you that my claim is true. It is common knowledge that illicit drugs can induce psychosis, causing the user to experience visual or auditory hallucination, delusions, and paranoia, which are unable to be distinguished from schizophrenia because these are the same exact symptoms of one diagnosed with this disorder. According to Pediatric Weeks, a diagnosis of any substance abuse increased the risk of developing schizophrenia by 6 times. For cannabis, 5.2 times, alcohol 3.4, hallucinogenics 1.9, sedatives 1.7, amphetamines 1.24, and other substances 2.8. The author concludes the increased risk was found to be significant even to 10 to 15 years after a diagnosis of substance abuse. Our result illustrates robust association between almost any type of substance abuse and an increase of developing schizophrenia later in life. An additional reference, you can read Medical News Today. If you will disagree with me, I will prove to you that my statements are credible. There are many studies that were conducted and explain why and how alcohol and drugs can trigger schizophrenia. They cause chemical imbalances in the brain, leading to presentation of psychotic symptoms, including psychotic relapse or increasing symptom severity. Substance abuse will definitely exacerbate schizophrenia. And if a patient is already diagnosed with schizophrenia, alcohol and drug abuse will cause them to experience further cognitive impairment, more intense psychotic and higher rates of necessity of emergency services. Alcohol can also increase the number of intensity of a person's schizophrenic symptoms, including delusions and hallucinations. It further impairs decision-making, process, and other abilities that are already impaired by schizophrenia. You may argue that the disease will not do it by itself. You will argue that the disease will do it by itself, but this is not so. There are many people with a family history of schizophrenia. For as long as the person is not experiencing tragic event that will cause a person to be tremendously stressed out, this disease will be dormant. Usually it will have a domino effect. You may ask why. This is because most of the time in cases of tragic events, a person seeks stimulants in order to cope to forget their problems. Unfortunately, most people turn to drugs and alcohol. Depending on how much they induce, they will determine if a chemical will be triggered so severely that schizophrenic symptoms will be manifested. I have given a lot of references in my writings, but you can also check the books written by Emil Kriplin, a German psychiatrist, also U.S. National Library of Medicine. I tell you the truth, alcohol and drug abuse is the reason why schizophrenia is being triggered. They are dormant until it's waken up by these two substances, drugs and alcohol. Thank you very much and have a good evening.